Yeah, g'day everybody, and welcome to the next talk on calves. This talk is just going to be a brief overview of the important points about calf rearing and calf management. For those of you who don't know me, my name's Henry Yule. I'm one of the large animal vets based out of Pukekohe. As with any of these talks, feel free to pop any queries, comments, or questions in the comment section below, and we'll do our best to get back to you as soon as possible with those answers. As with anything on farm, we always want to make sure that we're really well prepared to anticipate any problems that might occur. So this really comes down to three things with calf rearing. Is the infrastructure ready, aka the sheds? Are the cows ready to actually have these calves? And are you and your staff ready for the workload that's about to come? So, are the sheds ready? We want to make sure that the calf sheds are disinfected with a nice, dry, soft bedding place. We also want to make sure that the water troughs are clean and functional. This is very important. We also want to make sure that a good calf first aid kit is available, and this should include at minimum a thermometer, gloves for yourself, iodine spray, plenty of electrolytes, and a good tube feeder. We want to make sure the cows are actually ready to have these calves. So pre-calving vaccinations, which can include Salvexin, rotavirus coronavirus, and BVD. So if you haven't had those done, make sure you get in touch with your vet and discuss options. We also want to make sure that you've got a good plan re-transition management and feed for the cows. This is important because this will help ensure that you calve down at an adequate and appropriate body condition score. And this will also help with any down cow problems post-calving. Some people may say this is the most important bit, but are you and your staff ready? With new staff coming on farm, it's really important that everybody's synchronized and everybody has the same understanding of what's expected when it comes to calf rearing. So just making sure that you've actually talked to all your staff and making sure that everybody's on the same page of what to do and when to get help and when to ask the right questions, just to ensure that there's no issues with any of the calves. So a good first aid kit, as I said before, at minimum would have gloves to protect yourself, a good digital thermometer that actually works, and make sure you can actually change it from Fahrenheit into degrees Celsius because that can always be a pain. A good iodine spray for navels, and a good tube feeder. A tube feeder is very important because unfortunately every year we do find some calves that have been force fed or tube fed and the liquid's actually gone down the wrong way, and unfortunately we do end up with dead calves after this. So just making sure that you've got a good one and that you've actually trained the staff appropriately to ensure that they actually know how to tube feed a calf. As I said before, plenty of good electrolytes and a lot of patience, because we know this is a busy time for you guys and we know people can get frustrated. Make sure you got plenty of biscuits and always ask for us for some of those. We're very happy to give them out, otherwise we eat them all ourselves. So it really starts in the paddock, doesn't it? First thing that kind of happens is we need to discuss is the pickup frequency. So how often are you actually picking up these calves? In the old days, it was always thought that people would just leave the calves on the cow for the first 24 hours and the calf would just drink the cow's colostrum. However, this has now been disproved with research saying that actually more frequent pickups and more a detailed focus on colostrum intake, that kind of means picked up at least once 12 hours, you actually get a better colostrum intake than those that have been left on mum for the first 24 hours. By picking up at least twice every day, you've got to ensure that those calves are getting at least some colostrum before their gut closes over to those colostral antibodies. We want to make sure that the trailer has been washed and disinfected between pickups, and we also don't want to overcrowd the trailer. Navel management is really important, so making sure that you're spraying the navels with a good iodine spray when you've picked them up, just to kind of prevent any navel infections. We also want to tag, record, and draft out that cow. So colostrum, this is arguably the most important part of calf rearing. With calves, they don't really have a great immune system when they're born. So you might hear us vets harping on about it because colostrum is just so important. This really sets up their immune system for the first couple of weeks and months before their immune system really starts kicking in by itself. So we call it the 3 Qs of great colostrum management. That's quickly, quantity, and quality. As I said before, absorption of these colostral antibodies only happens over a short period of time. After 12 hours, only 5% of antibodies can really be absorbed, and after 24 hours, the gut is completely closed to any absorption of those antibodies. So that's why getting at least 2 litres in on that first pickup is really, really important. Quantity is a huge thing as well. We want to be feeding at about 10 to 15% of the calf body weight. That usually equates to about 4 to 6 litres per calf within that first 12 hours. We want 12 litres of gold colostrum fed or chewed when brought into the shed. And quality, very, very important in this. We want these calves on their first ever colostrum intake to be gold colostrum. This is the cow's first milk since she's given birth. Any milk after that in that colostrum time is called transition milk, but we want to make sure that we get that gold colostrum into those calves. Again, this quality is dependent on the time between calving and her first milk, because as her udder engorges with milk, the dilution of those antibodies can occur. So we want to make sure that we're getting her in and milking her out as soon as possible. As I said before, this is affected by the cow's condition and any pre-calving vaccinations that you've undertaken in the herd. So when it goes wrong, we call this failure of passive transfer when the colostrum intake does not equate to good colostrum transfer over the gut. And unfortunately, up to 33% of farms in New Zealand do not have great or adequate colostrum management. And it goes wrong in those three ways. Either the quality is not good enough, you haven't given them enough, so the quantity, or the time taken to get into the calf has been too long. As I said before, that those calves left on their mum for 24 hours had an increased level of failure of passive transfer than those calves picked up at 12-hour intervals. Also need to consider bacterial contamination or throughout the storage of the colostrum. So making sure you've got that adequate. And why does it go wrong? Either starving levels are not appropriate for the heavy work demand of spring, staff have not been educated on the importance of colostrum, or there's been poor hygienic control protocols, i.e. not washing out effectively between feeds, not using hot water or disinfectant. So it's just all those things. The good thing that we can do is we can actually test the quality and actually test if colostrum or colostral antibodies have been taken up by the calves. We do this by two ways. We can either test the colostrum itself, and we do this using a refractometer, which is just a fancy word of saying measuring the solids in the colostrum, and we use this with a Brix refractometer. So this little picture on the left is just showing a refractometer. So what you do, you place a little bit of the colostrum on the little glass vial and then hold it up to the sun, and ideally we want a reading over 22. This is indicating a high antibody level, and this should be fed to the 1-day-old calves. Reading between 19 to 21 is indicating a moderate antibody level, and this can be fed to those 2 to 4-day-old calves. And the low colostrum, less than 19, is low, and that should be fed to any of the older calves. With the blood testing, this is when we come out and randomly select kind of anywhere between 6 to 12 healthy calves at kind of day 7 to day 14, and then again in the middle of the calving season, and just take some bloods and just see if they've actually had an uptake of colostrum and that everything has been absorbed the way it should be. So what should a healthy calf look like? They should be bright, alert and responsive. They should be actively suckling, and they should have warm extremities. They should be wanting to interact with other calves, and they should be eating meal that's available. So what does a sick calf look like? Well, as your typical ones, they'll have sunken eyes, droopy ears, cold extremities, isolated from the other calves, not wanting to get up, not wanting to drink, and has a high or low temperature. So unfortunately, scours is still a very, very common occurrence in a lot of dairy farms in New Zealand. Unfortunately, when we come out, we can give indications of what we think it might be, but without kind of poo sample sent to the lab, we can't give you a definitive diagnosis. So the main causes of scours in New Zealand dairy calves are E. coli, salmonella, rotavirus, coronavirus, and cryptosporidium. You've also got nutritional down there, but they don't tend to be as poor. It's also important, and that's why we need to wear gloves, that salmonella and cryptosporidium are zoonotic, meaning that you can get them. So if you do have scouring calves and a vet asks you to take a sample, always remember to wear gloves. So what to do? We want to isolate the calves early to a designated sick pen. We want to get advice early, whether that be from your manager or from your local vet. And we also want to treat early. With these guys, dehydration is the biggest risk. So we need to make sure we have appropriate fluid and electrolyte therapy. The important thing with these guys, they're so little that they don't actually have adequate fat reserves. So we need to, it used to be the school of thought that you'd only give calves electrolytes during the scouring period. However, this has been disproven because they do still need energy. And so that's why we need to think about alternating the milk and electrolyte feeds. So quite common, people feed 2 litres of milk in the morning, then followed by 2 litres of electrolytes in the afternoon, again 2 litres in the afternoon, and then have free access to electrolytes all night. Unfortunately, if they're not wanting to suckle at all, or they're down and lethargic, they may actually need IV fluids from a vet, and so always have that in the back of your mind. They also may need pain relief and or antibiotics. So just a couple of other problems that we do see commonly, and just to have a look at. Navel ill, this is quite a drastic version of navel ill. We never really see it that bad. But what usually happens is they get a little bit of an infection in their navel and little abscesses can form. So as with anything causing a sick calf, you want to look out for kind of a rise in temperature, any isolation from the group, or pain when you palpate down there. And that's the same with the joints as well. So as you can see here, there's that joint there is quite swollen. So it's most likely got a bit of pus in there. So we just want to have a quick look or a good feel of all the joints when calves come in and over the first couple of days. Any heat around a joint or any lameness, it's important. So get in touch with your vet, and we can have a discussion about what to do with those. Pneumonia is also an important thing. Not so much of an issue in New Zealand compared to those calf rearing systems overseas, but we still do see a fair bit of it. And again, droopy ears, coughing, nasal discharge, high temperature, any of those things, just give us a call and we can give you some advice over the phone about that. Again, with any of these things with calves, we want to make sure that we're looking out for them early and treating them early. As I say, we want to be proactive as opposed to reactive. So yeah, guys, thanks for that. Nice short little discussion about calf rearing. Any questions, just flick them down below. But other than that, have a great day.